to the real heart of the matter. What do we want to do? We want to regenerate. We want to make new tissue. If it was so easy, we would have done it long ago. But we're on the quest and we do have some tools for it. So what do we mean? Well, like the salamander can grow in 6 to 9 weeks, can grow a new limb. Bones, skin, nerves, the works. We're not quite as good as that, but we certainly can grow tissue, certain tissue. So regenerative medicine, it was founded, the term was founded in 92, and it's the opposite, it's the real anti-aging medicine. The key of regenerative medicine is stem cell technology. Is it ready for the big time? Not quite yet. So, I think we injected you with the wrong stem cells. So obviously they grew petals, you know, like the wrong stuff. That's the fear. At this stage, there is no stem cell technology which is entirely predictable about what exactly is going to grow. And there are cases of people injecting things which grow the wrong sort of tissue. It will come. You cannot just suck your stem cells out and inject them in your brain and think you're going to grow brain cells. We wish that it would happen. But at this stage, the only good applications for stem cells are joints, growing cartilage, and possibly skin. Not yet available in Canada. The nearest thing we come to that is platelet-rich plasma, PRP. Because your platelets, not the white cells, not the red cells, but the platelets, those little sticky things that form the clots, they produce growth factors which stimulate the growth of new tissue. And it's those guys that we want. It's not the red cells and the white cells. So there is a technology where we can get just those platelets and the water. And it's called platelet-rich plasma therapy. You know, it stimulates tissue, increases collagen, smooths out wrinkles, and gives you a healthy glow. So which type is it? That's called Selphyl. Selphyl is the branded name, Health Canada approved version of platelet-rich plasma that is available. It's the cleanest because it separates the red cells and the white cells which you don't want. They cause either bruising or inflammation. Rather, you want the platelets and the plasma. So how does it work? So you inject the platelets in to the skin. There's hyaluronic acid in the skin, and that's the level at which the filler goes. There are the wrinkles. The platelets down over there, they start producing growth factors. They release signals which attract building blocks, and the collagen starts to grow and pushes up the tissue. And that essentially regenerates the quality of the skin. So what it is once you've spun the blood down, take the blood, spin it down, the top 55% is the plasma. It's got some white blood cells and platelets that stick to that buffy coat, and then the red blood cells underneath is 45%. So that's the component. You want the plasma and the platelets. That's the stuff you want. So this is the Selphyl technology with that coat. And you can see from 1 9 ml tube, you get about 4 or 5 mils of the actual good stuff. And that's about enough to treat the loose crepey skin under the eyes and maybe 1 or 2 more lines on the face. To do a full face, you would need a little bit more. But that is a picture before and after. You can see the loose skin, the crepey skin, and here a little bit filled out. That's the concept of Selphyl.